Hi, I'm Dr. Chris Chase of Associates in Plastic and Reconstructive Surgery in Chattanooga, Tennessee. Today I'm going to give a brief introduction into the difference between saline breast implants and silicone breast implants. Many people come to our office wanting breast augmentation, have done some preliminary research on the implant differences, but oftentimes have never seen the implants. I'm going to demonstrate those to some extent and give some basic information on the differences. To my left we have a saline filled implant, and to my right I have a silicone gel filled implant. This one happens to be a 400 cc moderate plus implant filled to approximately 420 cc's. This one's a 375 moderate plus. The difference in the outer shell is minimal, as they're both composed of silicone material, which is a very inert substance that when placed in the body is very well tolerated and the body doesn't try and reject the material. The saline implants actually come filled with air. When we take them out of the box, they have a little fill port here that we stick the fill tube into and suction the air out so the implant collapses. That allows us to put the implant in smaller incisions or through different means, such as through the transumbilical approach, because we can fold the implant up and tunnel it in various fashions. When we put the implant into the pocket, then we have the fill tube in place and we fill the implant up to somewhere up to its range of fill. One good thing about saline filled implants, which by the way, saline is just salt water, and we use sterile salt water. So if the implant were to leak, then the saline would leak out of the implant and the body just absorbs it. Another good thing about the saline being able to fill them up in the surgery is each of the implants has a range of how much fluid can be placed in the implant. So if there are some minor differences from one side to the other, we may want to put a little more fluid in one side or the other. Also, it just gives us some flexibility on how much fluid we put in, which then gives us some flexibility in the size of the implant. On the other hand, the silicone gel filled implants are pre-filled to particular sizes, but they usually increase by increments of approximately 25 cc's to 30 cc's, so we can usually find a really good size to fit with either one. Because they're filled with saline, the saline filled implants are a little bit less expensive than the silicone gel filled, partially due to the requirements that were placed on the implant companies to bring the gel filled implants back. These newer gel filled implants are very safe. If they were to leak, they actually, the older implants were more of a liquid center type silicone, and if they leaked out, the silicone gel would more or less run out of the implant. Also, the older implants the gel would somewhat bleed through the shell, and if you touched it, you would have a slick surface. So these characteristics, especially with the leak, could cause some problems with the body reacting to the silicone material. These newer implants, however, even if you cut a hole into the implant, the gel is a cohesive gel. It sticks to itself, and even if you were to squeeze the implant, the silicone leaking out would actually contract back into the implant once that pressure was released. We can get very nice results with both implants, especially from a visual standpoint. Sometimes the main difference that people like, or the main factor that people use to choose the silicone gel over the saline implant, would be the soft characteristic of the silicone gel versus the saline, which may feel a little bit more like a water bag to some extent. Depending on the amount of tissue coverage, this difference can be fairly minimal. If a very thin patient, the difference may be more noticeable. Sometimes the implants are palpable, or in other words, a person may be able to feel the implant kind of under the skin or under the breast tissue, in which case the saline filled implant to my left would feel a little bit more obvious that it's an implant compared to the silicone gel. These are some of the basic differences between saline and silicone implants. I'd like to talk to you more about them if you'd like to come in, and we can explain them. We'll show you implants, we'll let you try on sizes, and answer all your questions. Thank you for watching, and have a great day.